Okay, I'm going to go first again because I always do.
Community is what heals us, right?
My takeaway would be, please let it be about you. Precise medicine, even if it's medicine 2.5, 2.8, make sure it's about you.
But the process out from a challenge is only attained by going through the challenge. What I see a lot is, especially with the work I do in psychospiritual integration, is people being very propositional rather than relational, and it takes them only deeper into it, not through it.
Question everything. Question. Better questions are the fundamental fuel for every advancement that happens. And if you're not getting results, recognize that either you're not asking the right questions or the person you're asking questions doesn't have the right questions. And recognize that we are all trapped in our own brain. Cognitive bias is an epidemic. We all have it. And so if you're not getting the results you're wanting, leave. Go somewhere else. Ask somebody who you know will disagree with you. I love having people around who disagree with me. And that's what you should do for your health as well.
I would say find your gateway drug. Find the one change you could make in your life that either has an outsized effect or leads to other good changes, leads you down a different path.
You are not your thoughts or your feelings, nor the thoughts or feelings of others. You are a monkey.
If you're fortunate enough to have a great working relationship with your healthcare provider and health team, count yourself incredibly blessed. For the majority of people, my hope for you is that you leave here inspired to find your team, build your team, fire your current team, do something where you get aligned with someone who can appreciate your values and your goals that you have. And then secondly, we live in a world where we're all drowning in information and we're starving for wisdom. What does it all mean? What do I do with this information? And it's enhancing the need, the necessity for having a trusted advisor to help you think about how you think about your health. I hope you find that. I want to introduce someone who's become a dear friend of mine. His name's Scott Moore. He's a patient of mine, and he was gracious enough to join us here to share a few minutes of his experience in this, as we're calling Medicine 3.0.
I was sure everybody was looking like, why is that guy on the stage? Did you all miss my session this morning? It was really good. I'm an entrepreneur like you. Sold my business a few years ago. Cracker Barrel was a restaurant chain. Cracker Barrel bought it. My statement would be, when it comes to medical care, don't take the status quo as your status quo. So what happened for me, I kind of fell into 3.0. As an entrepreneur, I got frustrated with the medical care I was having at where my doctor was in the hospital system. I'd have to make an appointment 4 months in advance. You know what your schedule is 4 months from now? Not true, no. And then I'd have to change it at the last minute. I would get there and I'd have to go sit in a waiting room for 45 minutes. Then they took me into a smaller waiting room for another 45 minutes, then put me in a room to wait for the doctor to make the rounds to come. And then I got 5 minutes. And it was only typically dealing if I had a problem, we'd find a way to try to fix it. So that frustration led me to start doing some research online and looking at what are the options here. And I found this concept called concierge doctors, where you can basically become a member of it. You have a doctor who's available to you. But when I met with Dr. Wenzel and was investigating it, what resonated with me is he said, I'll help you if you get sick, but that's really not my job. My job is to see how you can live the healthiest life and the longest life you can live. Well, that's totally different than what I'd had with doctors up to that point. And so we met yesterday, have the test, talk about how things are going, and try to figure out how I can live the best life, not just get fixed. Why it was so important is after I signed up with Dr. Wenzel, he collected all my tests I'd had for a couple of years. And he called me on the phone and said, hey, this one test you took 2 years ago, what'd you do about it? And I said, well, the doctor told me to lose 15 pounds, and that's what I did. And he goes, that's all you did? And I go, yeah. And he goes, we got to get another test. Well, he sent me in, and they went in and took a camera into my heart and veins, and when the doctor woke me up, he immediately wanted to roll me in to the surgery room and do quadruple bypass surgery. I struggled with that. I'm like, whoa, you just did a test and you're going to cut me open and take out my heart? And I so I talked to Dr. Wenzel and said, I want to investigate, is there not other ways that we could do this? There's robotic bypass surgeries. And so I talked to different doctors, and one at Mayo Clinic from Jacksonville, Florida, where I came from, he looked at the test results and he said, Scott, here's what I can tell you. If you're looking me eye to eye right now and you have a cardiac event, I don't know I can bring you back. And I promise you, if you don't do something now, you will not be here a year from now. So here was the thing. I had no symptoms. I didn't know I had a problem. And my doctor, who I just had seen, didn't indicate anything. And it wasn't until Dr. Wenzel said, you got to do the test. I would not be here today to tell you the story of what happened if not for this type of medical care. Which saved me.
This is Benton White. I want to be so private about it, but he's my patient.
No problem.
And so I'm going to let him just speak to what I've been preaching all morning.
It's a pleasure to be with you. I was honored to get to have this opportunity because my wife told me the other night, she said, you'll do real good at this because this has been your hobby for the last 7 years of trying to find right medical care. And I found it. But you and I are bookends down here, brother. Yeah, I got a similar story to you, but I'm an insurance guy. I've been in the insurance business for 45 years, just passed it last October. And I have a great client base, and I am 71 years old this May. I've got a wife that I've convinced to stay with me for 30 years, and I've got 11 grandchildren, ages 4 through 18. And I am a living testimony to what learning and studying the medical fields or the medical profession or what we as patients can get and how you can turn it around if you spend a little time doing it. It began about 7 years ago when I began to follow Dr. Mark Hyman and nutrition. Well, mine was wrecked. And my wife and I began to read his books. We began to follow. It's all I had. No doctor had talked to me about nutrition. I had a doctor I'd been with for 25 years at that point. And I love him. I loved him then, I love him now. But he just did not address my issues on an offensive basis. He dealt with them on a defensive basis. What's your problem? Well, let me write a script. What's your trouble? Oh, okay, let me refer you to this. And it got old, and I just started thinking there are better ways to do this. And then I picked up on Dr. Pruitt, and then Peter Attia, who Outlive was just a Bible in my book. I've read it. I love what it said. Taught me the 1.0, 2.0, 3.0 medicine. He's a whiz. And so in that journey of going through those things, one of the things I did learn is that you need better testing. And what sort of did it for my doctor of 25 and now 30 years, up until about a year and a half ago, was I found that I needed more blood work. I needed more testing. I needed to know where I stood and what was going on. And so I took this list that I had read from some of these guys that I considered authorities because I had nobody else, and I gave him the list of testing that I wanted to do. And his words to me were, quote, "Who's been doing this voodoo magic on you? You don't need this stuff. We don't do this stuff. Why would you ever consider it?" Because I want to know where I stand now, Doc. I want to know what the picture is so I can prevent it. Then what I did is I went to Mark Hyman created this beta thing where I got to be a part of it, of Function Health, and they did 100+ panel. And I learned about where I am. And then I started searching around Nashville, and I'm sort of like what you said. I was looking around for different doctors that could do maybe the language that I have learned and wanted to do more of. And I called some of the offices of probably some of your people. And I kept searching, and I kept trying to figure it out, and had a very good church friend of mine who said, "You need to see her." And I said, "Okay, I'll try it." And so I went last April, and I had felt like I'd been in a parachute all these years and trying to figure out where to land. It sort of go this way and where the wind blows. And finally, I felt like when I walked into Dr. Cordove's office, I had landed because I had heard enough, learned enough. And when I walked into her office, I didn't have to worry about a long wait for an appointment. I called them, and within 48 hours, I was in her office. I had not met her yet. I walked in, and her assistant took me, did the vitals, and she said, "Your blood pressure's higher." I said, "What is it?" She gave me a number. I said, "That's about 20% higher than normal." I said, "I'm like a 120 over 73, 70, 74, something like that." And she said, "Well, it's higher than that." And she gave me the number. I said, "I'm just glad to be here." And she said, "You're just excited you found a place to hang your hat." I said, "It's hanging." And it was blood pressure up. It has been down ever since. But I have found someone that talks offensively and is realistic and lets me make choices based on data. Yes. And it took a long time to find it, but I'm glad I have. So I'm in pretty competent hands here. At least so far she's convinced me that she's pretty good at this. We'll see. But it has been an exciting journey so far. So thank you very much.
Thank you.
He's also one of the ones that, when you eat key lime pie, or what was it, that I get to see his continuous glucose monitors and call him and say,
right here, right now.
"What was that? What did you just eat?" So that's fun. Yeah.
Thank you. Thank you both so much for sharing your story. Sorry. So now we're going to take questions. Anybody got questions? Come on up here to the mic for our fabulous people.
All right. Well, after today, there's about 400 things in my life that I should probably work on, but I'm like, what is something that I feel that affects me the most that you all have talked about? And other than I want to get one of those glucose monitors, is sleep. And I feel like a lot of people in this room probably, I plug my phone in downstairs, I go upstairs, I don't have screen time before, whatever, I can't, it's not the falling asleep. I can fall asleep, but I am up throughout the night just thinking about, I'll panic, I don't know. It's like, what's going to happen 17 months from now with the, whatever it is. I think about, what do you all recommend? I mean, is it melatonin? Is it something that will help you stay asleep? Because I'm hearing more and more how important sleep is, and it's the one thing that I don't know how to control. I mean, I can stop drinking if I want. I can eat healthy, whatever, but like sleep evades me. What do you recommend?
I'm going to steal Dr. Wenzel's line. It depends. No. But I think what's always important is to ask the question, when were you last well? I mean, did you ever sleep well? And, and start to ask the questions because, the issues in your tissues, but the answers in your life, right? And, and so did you have a trauma? Was there something that you set you up to go like, wow, my brain better learn how to stay alert, right? And that's because somewhere we believe that that's going to protect us from being dead. Did you happen to have a change in your environment? What's going on in the air that you breathe? What's happening in that? What's going on with your bed partner? Sleep. You're right, is a challenging thing. But one thing that people forget or don't know about sleep. Does your brain shut off in sleep? No, your brain is actually just as active in sleep. Your mitochondria that regulate your neurons that actually make you unconscious and paralyzed need to have great energy in order to maintain that. So actually low cellular health will actually lead towards sleeplessness. And so people go like, well, wow, so cellular energy is something you may want to be thinking about. Where did this come from? But I think it's always important to ask those questions. Make sense? Oh. And I'm sure there's, everybody here has an answer for that, okay? Because it is so. I congratulate you on recognizing it as an issue, and I encourage you keep asking more and more questions. Fair?
And I have one thought about Ambien. Valerian root and hops went head-to-head against Ambien, same clinical efficacy. And we don't know, Ambien is such a potent amnesiac that we're not sure whether you're up all night texting ex-boyfriends and you just don't remember it, or you actually get some sleep. So Ambien is absolutely not the answer. I have plenty of patients on Ambien that I cannot move. Again, it's where you are, what you're willing to change, and the things you're willing to do. But
and I'm
Ambien, if you can help it.
I'm so glad you said that because Ambien is very clearly associated with causing dementia. Okay, the Z drugs, the sleeping medications, the benzodiazepines, anything that kind of makes you tired, they make your brain sleepy. Sleepy brains get dementia. Okay, so you have to address that. We would also do like a quantitative EEG, actually measure the electrical brain map, and we'd see what is that. That's actually quite helpful at helping reset people. There's multiple ways to do that. I'm just going to run through a bunch of things here. Then there's ketamine therapy can actually be a great reset button. That's something that we've been surprised in watching people go through that process in our clinic that all of a sudden they're sleeping better after that. But I think that's dealing with some underlying trauma that they couldn't identify in another way. Magnesium threonate can be really wonderful. It's a great absorbing form of magnesium and associated there. Anyway, but I just couldn't stop on them because it bothers me so badly. The medications that suppress your brain will lead towards more dementia. No, but small doses of melatonin, like a 0.5 milligram, great. And then melatonin can be used at very high levels for other purposes. So,
I'll say real quick, there are 8 billion central nervous systems on this planet. No two are exactly alike. You are an N of one. You are a subject of one. Get a notebook, track this crap, and then start split testing. Do one thing at a time and say, hey, my sleep is down 20%, get an Oura ring, get the Whoop, get data, because our memories are crap. Well, it seems like I'm sleeping better. It means nothing. How are you sleeping? Well, my Oura ring says I've slept like crap, but I feel okay. And then you start to hack that stuff and you become your own doctor. I mean, that's really where I'll guide everybody, is take responsibility for yourself. Nothing is permanent. You can change all of this stuff, but keep records of it. Know what worked. Don't change 13 things at a time. Just add magnesium and see what happens. And go from there.
Hello. My question is for Aaron and Leah. I loved your idea of keeping a health dashboard. So I want to know what metrics or KPIs you suggest for that. So Aaron, just kind of your basic one, and Leah specifically for women.
That's a lot. It's chunked down into, I have a cardiovascular page, I have a cognitive decline page, I have a screening test page, I have kind of a snapshot page that is all of your family history, your meds, your specialists, everything, so it's quick to find, update. I basically reverse engineer the killers of humans, like I mentioned in my talk. So I want to major in major things. There are some experts in here in the micronutrients and the things that are like, I know they're important, but I just don't have room for them in my practice because I'm so obsessed with de-risking someone's cardiovascular risk for their future and cancer and dementia, that's where I spend the bulk of my time. And thankfully that correcting a lot of those things corrects a lot of sleep, a lot of mood disorders, a lot of relationships heal, a lot of those kind of things. And where I need additional help, I reach out to some of these people on this panel for extra help. I think the biggest things in my dashboard that don't exist, high likelihood they do not exist on your annual report, are around your lipids, which are your cholesterol. They include the LP(a), everyone gets one. Measuring your LDL particle number. I particularly measure something called ApoB, APO, letter B. We know that those two are, I call them KHIs, key health indicators, instead of your KPIs. I also specifically look at something called your triglyceride to HDL ratio. You can find that on a typical lipid panel, but this gives great optics on your overall insulin sensitivity. I suspect everybody in this room is probably getting a hemoglobin A1C. I also suspect they're not getting fasting insulin level. I would highly encourage a fasting insulin level. Elevated insulin is the devil. In my gospel according to Wenzel, it's the gateway physiology to all the disease we are on this panel talking about avoiding. And if you don't have eyes on where your insulin is, it can be problematic. If you're over the age of 45 or a profound family history, or you're just neurotic and you want a baseline, I highly recommend something called a Clearly study, which is an AI-generated overread of a high-resolution CAT scan, which will look at your coronary arteries to tell you exactly where you are in terms of the #1 killer of humans. You will have to pay cash for that, your insurance, because if you don't have chest pain or shortness of breath, they will not pay for it, which would be by definition late, very late actually. Probably greater than 95% blocked. GRAIL, Gallery by GRAIL for cancer screening for those that are well informed and understand the risk of a false positive. I think those are the big ones. And then your hormone panels, especially for peri and postmenopausal women, and any man over 40 really needs to have eyes on where his testosterone levels are.
Agree, pretty similar. Also, I like to look at homocysteine. It's never been proven to move the pin on cardiovascular mortality, but it has implications for methylation. So sometimes, if it's appropriate, MTHFR, but every single patient has a different set of metrics that I look at. In women, maybe I incorporate the PHQ-9, which is a depression scale, the generalized anxiety score, because that's where you're going to see hormonal changes first. I don't think I do much different than probably that, but more important than a dashboard is really just hearing where my patient is, and not every patient gets everything.
Hey y'all, I'm Angela. Thank you so much for everything. I've got a million notes. And I I have a complicated health history. I had 2 strokes at the age of 30, and I've been a Mayo patient for a long time. I think I do a pretty good job at my health dashboard. However, I have one specific thing that no one has ever addressed that I have always looked at ever since I had the strokes, which I'm doing better, so I really believe that my body is healing itself. I have a 3,000 count white blood cell count. The plasma and the stuff that you're doing, Dr. Haase, is really, it's so intriguing, but how do you get more white blood cells? Can you do that with Exchange? Like, can you put in more stuff? How in my 54 years, no, I'm only 53. 52, sorry, 52. This 3,000 count white blood cell count has never ever changed in my dashboard at any given time. So that's a specific question, but it's more addressing the number of cells that you have in things. Can it ever go up and down? Red blood cell counts, those things. Well, I guess that probably does, but the white blood cell is specific.
Really quickly, and then I'm going to give it to the smart guys. Why do you need more if 3,000 are working, right? So maybe
because they tell you 10,000 is what you.
Well, these are averages, right? So it's the bell curve of 50,000 white men that were studied in order to determine the ranges of normal. And if you have 3,000 generals, why would you want 7,000 infantrymen, right? So if you have been healthy and without any immune compromise, then your 3,000 are working like champs. And it's great that 3,000. So maybe look at the differential, but my first impression would be if you haven't had any issues, then maybe your 3,000 are amazing. And that's how, right?
So several things. Lower white count are common in individuals who are endurance athletes. It's actually thought to be, quote, normal, but that's because they live in a world of excess oxidative stress, and they're not recovering well. We also see white counts get low after chemotherapy, and that's because there's been a poisoning of the bone marrow, and that's tough to recover. One way to look at this is to do a lymphocyte mapping, which is to look at the subsets of T cells, B cells, CD57, CD8. There's a whole bunch of subcategorizations of different lymphocytes, and the number of white cells you have may not matter as much as the number of the subspecies of those white cells. White cells are a very global term. And especially in understanding complex immunologic disease, complex chronic illness, that quantification can be really helpful. So there's just a couple of things, and recovery is incredibly important. Know your oxidative stress levels, because that contributes pretty greatly. And I think being curious about those numbers is great, but not being neurotic. So I mean that at some point you have to go like it doesn't all have to fit perfectly. I mean I agree with Leah's, but I congratulate you on digging in and going for it and really seeking to understand the why behind it. That will always give gold.
Thank you, and I'm going to leave with the question that I'm sure is for everyone. How much does all this stuff cost? Like, how do we need to budget for all this?
Our program is completely outside of insurance. We have a deep belief that magic happens when the only stakeholders in a doctor-patient relationship are the doctor and the patient. The economics of that make it a premium product. We're $10,275 a year. That gives full access to your physician 24 hours a day and their medical team, and also includes all routine and ongoing testing. So we don't charge for blood work, we don't charge for things. So if we can control it, we can bring it beginning to end. It's included. Doesn't include imaging, doesn't include medication, doesn't include some of these extra fancy tests that not everybody needs, like the Grail test. It's a little less than $1,000. This is our model. It's not for everyone. But there are other models with other price points that may make sense. That's where we're at.
I'm sorry, I keep turning this off. The Grail test in our office is $1,250. The whole body diffusion weighted MRI is 3,800. The Clearly is about 3,000. A calcium score is 50, and a body comp is 75.
So like Maxwell Care, so our clinic is about 12,000 square feet. We have 9 clinicians, some people that are some wonderful humans that are sharing space with us, and so Maxwell Care is an underlying cause quest type of an operation. That's about $4,500 a year, and that also is outside of insurance. And there's a host of how do you go about understanding what that individual may need. It's relationship centered and customized in that way. And then, as far as like the lymphocyte map that I just mentioned, you said, what does that cost? That's about $450. And we try to keep most everything we try to do negotiations for patients to lower cost whenever possible.
So when it comes to diet, every time I Google something about nutrition, I just don't know what to believe, because I have 3 or 4 different answers to the question about diet. And so I find myself leaning towards podcasts for my medical information. And I know that's not wise, but is there an online resource that can be trusted?
We wrestled with this a lot in writing Outlive, and ultimately we just kind of gave up. The diet world is so riddled with biased research, cherry picking, bad studies, and it's so complicated, right? Like, if we did a study on what everybody here eats, it'd be really hard to pick out any one thing. That's why the study I talked about was so powerful, because it was the one thing that was added concretely to these folks' diet. And that's why also we kind of I think everybody likes the glucose monitor. But, if there was a continuous cholesterol monitor, that might change things as well, like the way you approach things. But the glucose monitor is kind of what we got. So, diet's very individual, right? Also, like all these studies come up with a huge variation between individuals. So they put some people on one diet, and some people will gain weight and some people will lose weight on the same diet. So it's just, there's just a lot of confusion out there, and I don't think I helped clear it up.
I've probably had to answer this question 17,000 times in the last 10 years. It's one of my most common questions I get, and it absolutely provokes, and it depends. What are your goals? Like, best diet for what? Like, what are you trying to achieve?
Longevity.
Then anything that keeps your blood sugar stabilized that's sustainable is the most specifically generic I could give you. But there probably are other goals if we dug a little deeper: fitness goals, performance goals. I call them vanity metrics, the way you look, the way you feel about the way you look, all of those things. What time horizon are you giving yourself? What are your palate? What are your interests? What are your economics? What are your resources? How much do you travel? What's worked before? What do you like? I mean, those kind of things. Kind of what Bill said. I mean, if I was just to give you a playbook, it would be slap a glucose monitor on and go explore. And the one that you like the most, that you perform the most, the best with, that keeps your blood sugar stabilized, that's probably best for you. And self-advocacy on this is going to be the primary driver for this. And eventually, you'll probably need someone to help you think about that thinking.
Thank you.
Let me just from a not one of these guys standpoint say this. She has me on a CGM. It's right here, right now. Because we want to be sure that, the levels are right. And she convinced me that you just don't know what you're eating sometime that might affect it. And I had asked for a reset on my treatment of this because I'm about to go on vacation. And I saw that as an excuse that maybe I can have a little good food here and a little good food there, or call it good food, but it's really bad food. And so I put it back on Sunday. She didn't even know it until I told her a little bit ago. And so But out in the lobby a minute ago, I got here and I was a little hungry, and I got a Kind bar. And I remembered her saying to me, Kind bar's got some sugar. Nuts are great, but Kind bar's got sugar. I just checked it, and it did peak after the Kind bar. And that's what I like it for, because I don't have a clue sometime what I'm eating, even though it's vegetables or whatever. This is a good rule or a run for me personally. I know that it's not tremendously accepted by a lot, but I love the fact that I can keep an eye on it. And of course she does too. So.
Oh, yeah. She didn't know he was on it. Also, Robert, I knew you were on it. Something really cool we're looking at in the obesity world is order of eating is really important. So I tell my patients, put your monitor on and play around with it. And I remember talking about, play around with it. So start with the meat, start with your protein, and then introduce carbohydrates and see how your curve changes. So order of eating is important, but nothing is sustainable for the long term unless you can sustain it. So the way of eating that works for you.
Thank you. That real-time feedback is super important. Same goes for Oura Ring and Whoop. I mean, it's awful hard to ignore your report, right? That's an extra kind of, you might as well just take it off and not have it. But, this technique is it doesn't work. And hope is wonderful, but it's not a strategy. When you're serious about getting health advancements, a CGM, an Oura Ring, or a Whoop for fitness and sleep, these are game changers that are essentially over the counter. Couldn't be more bullish on both of those technologies.
Last question. Appreciate you guys coming out and sharing this morning. A lot of information. I feel like I'm a pretty healthy guy, right? I work out, I eat pretty good. I need to work on my sleep. I'm actually 120 years old, but I look 30, and so I have two quick questions, if you could address those. I've been intermittent fasting for years, over a decade, most mornings, unless I have a free breakfast to eat. But can you talk to the benefits of intermittent fasting? Because sometimes my friends come to me and say, I need to lose 5 pounds. I'm like, just intermittent fast, For me, it helps me maintain my weight, and I think it helps me look good, too, me look younger. No, I'm serious. Also, my second question is, I do endurance, crazy workout training, right? I run ultra marathons, and I'm training for a 50-mile race right now. And people always tell me, dude, your knees are going to be tore up when you're 60 or 70. Although I know a ton of people that age who've run a ton of ultra marathons, too. So can you talk to some things that I should be thinking about if I'm doing some extreme workouts and plan to do that as long as I live, or for the rest of my life, for the most part?
I'm holding a microphone, so well, congratulations on being 120. You look great. The only thing I'll say about intermittent fasting is it kind of does what a lot of diets do, is it kind of puts a wall around your eating, and I think that's useful for a lot of us. Certain things we won't eat, certain times you won't eat, so you're kind of limiting your caloric intake, so you're not just eating all the time, right? So that kind of keeps things, you're keeping it within bounds, if that makes sense, right? So I think that is probably the best benefit of intermittent fasting that I can think of.
I have so much to say, but I won't. Big fan, intermittent fasting. I define that as greater than 12 hours on any given day, not eating, no more than 24. Far less bullish on long-term fasting, 3 to 5 days, than I used to be, for reasons mentioned by Bill with muscle loss. Very difficult to maintain lean mass when you're starving. Your body will consume your own muscle for the amino acids it needs. I think there's tremendous inherent discipline, and there's the freedom in the discipline that I really, 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 really like about just eating twice a day. The downstream secondary, tertiary consequences of just skipping one meal, either the first one or the last one, is decision fatigue. We all make a living with our brains, unless you're actively a ditch digger or a pool digger. But even if you're a pool digger, you dig with a machine. So like, you're thinking. And so we only have the capacity to execute high-level decisions, so many in one given day, before sleep allows us to reset. And if you can eliminate 33% of what should I eat, that's a lot. Every day, that's a huge return on one decision. And it simplifies things. I'm that way with my diet. I'm that way with my training. I'm that way with my outfits. Like, I just suffocate excuses. There's no debate. I just do. And it's amazing when you start compounding those things. And then there are a few aliens in the world who can run 50 milers and 100 milers all through their life and just continue to move biomechanically in a very well, non-pathologic way. There are very few. There's just something about, we're created and been designed and refined to do two things really, really well. One is explosive movement, fight, flight, jump, sprint, high speed, high endurance, or walk until the sun goes down. So like low intensity and high intensity, we're really, really designed to do those really, really well. The medium intensity things that go on for like 24-hour runs, the area under the curve for what you're absorbing for risk of injury is off the charts. And eventually, your knees and your hips and your ankles can only take so much. And if you have any propensity for arthritic, early accelerators of arthritic changes, it's not a guarantee, but it's a risk. You have to be willing to accept the risk with that type of fitness. That was what I would say.
And I know, but I'm going to disagree a little bit, because I think humans have an amazing capacity for endurance, and it's one of the ways we used to run down large animals in packs. We can outrun a horse. Do you know a human can outrun a horse over the distance? It's profound, and so we have a profound capacity. And but how much recovery do you get is actually what I would emphasize on, because it's one thing to go outrun a horse over the course of a day. It's another thing to do that day after day. And so looking at heart rate variability, look at your oxidative stress markers. What's your 8-hydroxydeoxyguanosine? What's your lipid peroxides? What are the things, the injury that you're doing to your molecules? Really important to mention. How much injury are you doing to your inflammatory stage? If you have any pain whatsoever, listen to it. Don't, running through the pain, I just think it's just pure stupidity. It's a gift. It's a gift your body's giving you to pay attention to something. And so that would be kind of maybe a contrarian view in some ways there.
Just one last thing, please, and thank you. So intermittent fasting, the maximum metabolic effects are the 16-8. If you start going into 24, actually irritability increases. So you turn into a bitch if you haven't eaten in 24 hours. But so the maximum benefits are at 16-8. There's some other specific things for other, but usually not more than 24. And you get a big surge of human growth hormone during that time. You're allowing your gut to detoxify itself. So that 12 hours of gut rest is actually super good for you. 16 seems to be the magic number. And I agree, unless your cartilage is terrific, you are transmitting 6 times your body weight onto your hips and your knees every time you land. If you love it and it makes you feel good, it's great for your heart, it's great for your muscles, and you're going to have great bone mass because of it. But there will come a time when you're going to have to address the inflammatory changes that structural pounding is causing.